Good morning again from Southern California. This is Dr. Anthony Chang, founder of AIMed. I'll be talking about COVID-19 and how it relates to artificial intelligence towards the vision how pandemics will be eradicated in the future. So we had an introduction in a previous video, and now we're going to have a brief primer on pandemics in general for our audience that may not be familiar with pandemics. So this is a quick primer on pandemics. So an outbreak of infectious disease is disease that is within a certain area and over a short amount of time. An outbreak becomes an epidemic when it involves multiple areas or regions, and then as it evolves into several or many areas around the world, particularly in different continents, is when the epidemic becomes a pandemic. And there's not actually a set number of countries or continents, but simply something subjective that is termed by the World Health Organization or WHO. So one of the important aspects or principles of the epidemiology of pandemics is the testing, and you hear a lot about this in the news. So generally speaking, a broad testing protocol at a very early stage, especially when a lot of individuals are relatively asymptomatic, coupled with contact tracing or tracing individuals that the patient may have come in contact with, is really essential and a very, very important part of containment strategy. And I know you hear about how different countries are doing in terms of testing. It's not obviously the number of tests that you're doing, but the number of tests per capita. And you can see on this bar graph that the United States is lagging behind many other countries in terms of number of tests per million people. Now, obviously, we take the number of tests divided by the number of people in that country. You can see that South Korea is very, very much ahead of the United States, which is trying to catch up. And Singapore, that is not on this graph, is actually even above South Korea. Singapore has close to 7,000 tests per million people. So when we talk about tests, we need to talk about tests per million people, not the absolute number of tests. Another principle that's very important is the concept of incubation period. And that's from onset of the infection to symptoms and positive tests is the incubation period, or how long it would take for the disease to manifest itself. And for SARS-CoV-2, it's 2 to 14 days. So that's very, very important, because when you look at this, the effects of the suppression strategy in Hubei that made the news was a total lockdown of dozens of millions of people. So the lockdown occurred here on January 23rd, and the lag time or the incubation period is 10 to 14 days, so about 12 days. And this is reflected in the fact that you don't see the numbers go down of the new cases until about 10 to 12 days later. So it's very important when we talk about suppression strategy or a lockdown that you should not expect to see the numbers to immediately change, and it will change about 12 days later. But when you back calculate the number of true new cases, actually the effect is immediate. I think two other principles are very important to talk about in a primer on pandemics. One is contagiousness. It's also called R0, or reproduction number, simply the average number of people who becomes infected from one person. This is a beautiful graph showing you the reproduction number, or R0, going from 0 to 4 or higher. So the higher it is on the y-axis, the more infectious the disease is. In some ways, we're fortunate that COVID-19 is actually not as contagious as some other infectious diseases in the past, like measles. On the x-axis is the case fatality ratio. Also, fortunately for us, so far the case fatality ratio is not as high as it can be. So Ebola and MERS that you've heard about in the news really intimidates a lot of even seasoned global health experts because the case fatality rate is so high and approaches 50%. So the ultimate bad virus will obviously have a high reproduction number, or R naught, so it's very, very contagious, as well as a high case fatality ratio at about 50%. So case fatality rate is the number of deaths per number of diagnosed cases. And this often leads to a lot of confusion. So I gave you 2 case examples here. So this is a typical season of flu where you have 10 deaths per 10,000 diagnosed cases. So the case fatality is 0.1%. This is with ideal conditions when the healthcare system is adequate and many are being tested. Now for COVID-19, we have the unfortunate combination of the healthcare system not being adequate. So you have 100 cases as opposed to 10 for the flu. And also the health system is stressed. Oftentimes, many are not tested. So you have 1,000 as opposed to 10,000. So that gives you a higher case fatality rate, which is artificially high because of these 2 conditions. So the numerator is higher because of the health system being stressed. Denominator is lower because there's not enough testing, so the overall number is bigger. So we'll see you at the next video on COVID-19 and artificial intelligence.